For coming to our fall event, and also thank you to our staff for working so hard to put this together and being here after hours away from their families. And thank you to Miss Krista for being our model and our volunteer for some injections. One of the common areas that we treat is the nasolabial folds, which are these small wrinkles that develop from the corner of the nose down toward the corner of the mouth. We also a lot of times will treat what we call the oral commissure, the corner of the mouth, or the marionette lines. She has a pretty well defined line here, which we call the oral commissure, but a lot of times for some patients, this will just kind of come into a more general area here where there's a low area or low line and deeper wrinkles. And then with Voluma, what we most commonly do is we put some here in the cheek and the lateral cheek, and it not only restores some youthful volume in the cheek, because most all of us lose volume in the cheek as we age. So, you know, like most people, if we get 20 years from high school, we put on a few pounds, but our face is almost always thinner. So if you don't believe that, go back and look at your high school yearbook photo, your senior photo. I promise you your face will be fuller than it is probably tonight. So when we add this volume here, it's not so much a cheek augmentation. We can do that for younger patients or patients who really want kind of an augmented, fuller cheek that they never had. But for many, we're just restoring volume that they've lost. And that alone will give a more youthful look to the face, but it also kind of sometimes will have a little bit of a lifting effect. So if you're starting to get a little early jowling here or a deeper line here, by putting that volume here, you'll also get a little bit of lift here, which can be pretty powerful on its own. So I think, do you have those Botox photos now? So probably be hard to see this on the video, but we'll try to post alongside it some still shots of this so you can see. So now what we'll do is, I mean, you see her kind of at rest, but why don't you show me how can you make this a really mean scour now? Yeah.
I'm not sure.
Yeah, so it's also great for Texas Hold'em players. Yeah. And you see when she smiles really big now, I mean, you see a little wrinkling here, but it's much more natural. It looks a lot more like what you see in a teenager or a young 20-something, not, you know, someone in their 30s, 40s, 50s, and beyond. So I think it's, you know, very natural. She can still move enough that she doesn't look frozen or fake, but definitely kind of a nice smoothing. So I'm going to clean your skin here a little bit. So we'll clean the folds here, corners of the mouth, maybe the jawline, the cheeks. Okay. All right, so does anyone have any questions? I've done this long enough I can do it and talk at the same time. Let's see. So, all right, try not to smile for just a second. Okay. So why don't you turn over this way so these people can see. So when I look at her, and try not to smile, so I think this fold is a little deeper on this side than this side. Can you see that? And also when I look at her, this side of the face, I think she's a little bit fuller, has a little bit higher, fuller cheek on the right side than the left. Can you see that? And that's pretty common. Most of us age a little bit more on the left side of our face, probably because we drive cars, and after 20, 30 years, that time adds up. So most of the time, if you look at yourself and you kind of look at the left or the right half, the left half usually looks a few years older. So we're going to address these lines here, this one first, and then I think we'll maybe go to the other side. At some point, we're going to do some Voluma, and we're going to try not just add volume to each side, but actually equalize the volume a little bit more, because symmetrical faces are always regarded by others as more beautiful, and that's regardless of age, gender, ethnicity. Symmetrical faces are always regarded as more beautiful. So, all right, so let's do this. If you just kind of relax here as much as you can. Little stick here. My hand's not shaking or anything. Oh, you're talking about her.
Just trying not to smile.
So hold on just a second. What's it feel like when it goes in?
Just like a shot. It doesn't really. I don't really feel the filler. It just feels like a shot.
Yeah, so the filler itself actually has some numbing medicine in it.
Oh.
So, you know, as you see me like injecting and re-injecting kind of in the same area, even if you feel, you know, a little discomfort at the beginning, it's more comfortable as time goes along. And Miss Krista's pretty tough, even though she's not had this done before, I don't think. You can correct me in a minute if I'm wrong. She didn't even want any numbing cream. So normally when you come in, we offer you numbing cream, which will numb the surface of the skin. Yeah. But these needles are so small and so sharp. I mean, you know, honestly, a lot of times you don't even really feel the stick. If you feel anything, you maybe feel the product start to go in. And as long as you're still and the injector's got a steady hand and does it slowly, that doesn't really hurt very much. Okay, so I'm going to hold this for just 1 second, and then I'm going to let you kind of look at this crowd over here, and we've just kind of done this area. Can you see the difference there? And you also have to remember she doesn't have on any makeup, so, you know, she put on a little foundation or a little something like that, and if you definitely don't see the pinkness, which sometimes the injections cause a little pinkness that gets highlighted when you're just looking here. And then look over this way and let everyone see. So we've just done just this area here. And so, and you know, it's very natural, very subtle. Subtle in that like she doesn't look strange or odd, but powerful in that like it definitely, you can start to see if you add 4 or 5 or 6 areas on the face where we make these kind of changes, how it adds up to looking more youthful. Okay, so I'm going to let you actually take one finger and just hold that. Let me do the other side here.
So how many injections do you do across here? 3?
You mean how many times actually?
Yeah.
It just depends on the patient and what we're trying to accomplish. So this product lasts about a year. In most patients, you know, this is generically called a filler, F-I-L-L-E-R. That means it goes in and fills up space. And it lasts about a year. And your body absorbs it. It's made up of hyaluronic acid, which is a natural part of the deeper layers of the skin. And so most patients, if they really like these results, they don't wait for a year until everything's completely gone. They come back every 4 to 6 months, often teaming up with Botox injections, which are usually every 3, maybe every 4 months, and we put a little bit in. We don't put the same volume it takes to start from someone who's not had anything. We put less volume in, but they kind of maintain that look. And as far as limitations, after sometimes patients ask, I mean, I don't recommend you do this and go like straight to hot yoga or straight to the gym, but you know, you can have this done in the morning, go to the gym in the afternoon for sure. You know, a couple of hours before you do any vigorous exercise. Now, remember this side was a little deeper. And again, I'll take a look. Now, a lot of times too, especially with first-time patients, and especially maybe the older you are, the more correction we need to do, a lot of times it's better to do a little bit and come back in a few days to a week, 10 days, and then put a little bit more. You can I feel like I can usually get a nicer result doing that than trying to do, you know, if we were going to use 2 syringes of this, rather than doing 2 right away, just do 1, let it settle for a week or 2, then come back and put a little more. I think usually get a little nicer result. Okay, so now, let's see here. I think maybe we'll move on here to what I was calling the oral commissure, the corner of the mouth. You see this deep line here? So I think we'll try to lift that up a little bit. It's not quite as bad. So this is kind of the opposite. On the nasolabial fold, this one was more shallow. This was deeper here. The commissure is deeper here and not as shallow there. So we're going to try to even them out and make them both a little bit better. Can you see that here? All right. You come close. All right, hold a little pressure on there.
Honestly, didn't feel that.
He's really good. I don't know which one.
Both.
It does help to have a gentle hand. It also helps to kind of have a real fundamental understanding of the facial anatomy, because one of the things that's going on here is, this, like I said, it has numbing medicine. The other thing that's going on is there's a big nerve in the face here that gives sensation from this area that kind of fans down. And so I did this first. So we're not only getting the numbing medicine just working in the skin, but actually to a certain extent kind of blocking that whole nerve a little bit. So it kind of matters the order you do these things in a little bit too. Oh, let me have everyone look at that before we go on. So now the corner of her mouth here is pretty tough or recalcitrant to lifting up. So this is definitely an area, if she were seeing me in the office, I would definitely say, I kind of want to stop right now, and I want you to come back in a week or 10 days and let's lay a little bit more on top. But again, I think you can see now, this one was much deeper. Let me look here myself, but I think we've got it almost looking as good as the other side now. Let you take a look over this way. And so we'll work on the other side a little bit. All right, there you go. And then, so down here we have a little bit of a dimple on this side. Can you see that? So we're going to try to soften that a little bit. As I said earlier, I think I injected a dimple on the first lady if you were not here. You can soften dimples, but you usually can't make them go away. And that's because what dimples are where a muscle attaches to the skin on the back side of the skin, and when you smile it pulls in. So you can never really completely overcome that, but you can soften it. So I think now one of the things I want to point out here that we're not going to do, but I want to point it out is, again, if she were looking for kind of global rejuvenation, the best we could do, one of the things I would love to do for her is, you see all these little vertical lines that come up to against to the red lip on the bottom, that kind of tightness there. So we can put a little Botox along this line and markedly soften and smooth all this out. So like when I pull here, you see how it smooths that? So with a little Botox here to relax some of the tension and the muscle under the lip, it'll just soften that a little bit. It'll also make the lip just have a slight more bit of pout to it, not anything that looks strange or abnormal, but it'll just make it look a little bit fuller. And so that is definitely something that would kind of help with this lower mouth area. So now we're going to do the voluma in the cheeks. So take a good look at her cheeks while I'm getting this ready, and kind of maybe let them see from both sides. Yes. So that's a very good question. So the Voluma actually lasts about 24 months. So, all right. Let me take a look here. All right.
It's nice to hear, whether it's true or not, it's nice to hear. We are. Yes, that we are. I agree with that one.
All right. So I think if you look at her, she went from kind of flatter on this cheek to actually just slightly fuller now. Can you see that? Take a look on this side.
Oh, wow.
Yeah.
Oh, it's really pretty.
Yeah. So, again, I'll have you take a finger or two and hold right there. And I take these.
What is that?
This is called Voluma.
Just Voluma.
Uh-huh.
That's it. Okay. Because I know they have so many.
Yes, it can be confusing. All right. Let's see. Just hold that. Just take a couple of fingers. There you go. There you go. All right. So if you look at her again here on this side, she's got a little bit of a low spot kind of here, a little bit more medially. You see that? So we're going to try to bring this up a little bit, and we're going to try to bring this cheek kind of back in harmony with the other side. So, and the other thing I want you to notice here, hopefully you'll be able to see it, is when we do this, look at the effects it'll have down here. Here, on this fold, and this the earliest hint of where the jowl is going to be one day, the effect it's going to have on that as well. All right. I succeeded for the first time to make her bleed. So a lot of times patients will ask about, bruising and stuff with this. And usually if you ask about it, it's bad luck. You'll be the person that bruises. But it's very rare to get bruising from this, especially bruising that can't be covered by makeup. Most of the time, patients, in all seriousness, who are a little bit more prone to bruising, I can usually tell just from looking. It's not always, but disproportionately, it's older patients with lots of loose skin. But it's very rare to get a bruise that can't be covered by light makeup. I mean, it can definitely happen, but very rare. So let me have you hold that for 1 second. All right, you can take that down. All right, and take a look over here. More even? Yeah? Okay, and let the ladies on the other side over here look. Yeah. Let's see here. All right, so hold a little bit right here. Now, the other thing we can do, so if you look at her, you see the jawline here? So if you go back around tonight in any of these rooms, if you look on the walls on some of these ad slicks from the different companies, and they have all these, you know, pretty faces on there. If you look, the jawline is always one continuous curve from the cheek, from the chin, all the way up here to the angle of the jaw. It's all just a continuous curve. And all of us, as we get older, we go from this continuous curve to a little jog here, a little jog there, a little jowl, and another jog here. And so we can very simply, for many, many patients, soften that a lot and start to hide this earliest hint here of this jowl by just putting a little filler between the corner of the chin and here. And for patients who want a more sculpted look or more angular look, I mean, we can do filler all the way from the chin all the way back to here and really kind of give a nice, smooth, angular look. But a very simple one that doesn't take a lot of filler, that really, you know, just makes a nice little adjunct for a lot of patients. Just putting a little filler here just to kind of hide that earliest hint of this little jowl here. And so I think we'll do that for you now, if that's okay. Does anyone have any questions? No? Okay. We offer all of our injectable patients after injections. We have some little mini ice packs that we give them. I mean, most patients, honestly, if they've been here more than once or twice, they decline them. They just want to pay their money and get back to work. The best thing to do too is sometimes patients will come to me and they're kind of worried about getting a bruise because they've gotten them before from other things, or you know, the safest thing if you want to mitigate your risk as much as possible of getting a bruise is to make sure that for 2 weeks before that you not take over-the-counter non-steroidal drugs like ibuprofen and Advil. Tylenol by itself is okay. That one doesn't make you bleed more, but most all the over-the-counter pain relievers make you bleed more. And to stop your vitamin E and fish oil, certainly if you take a baby aspirin and it's safe for you to stop, take a look at that. Yeah. Yeah.
Did you use Juvederm or Voluma?
This is Juvederm.
Juvederm.
Yeah. And so, I mean, and you can keep going with this. I mean, again, I'm just trying to show you how simple it can be, but I mean, we could make her look very, you know, very angular all the way across here by doing this more aggressively. And here again, just the earliest hint, you can see kind of where the jowl will be one day be. And it's not yet. If you're out there and you're doing this, and it's probably going to be something you're only going to do for a special occasion for a wedding, or you know, some big reunion or something like that, you want to do this kind of stuff. The best thing to do is start about a month or 6 weeks in advance. That way, if we want to do a little bit and have you come back and maybe do a little more, there's plenty of time with still, you know, a good two weeks before whatever event you might have, just on the off chance you get a bruise or something like that. And hold a little pressure there for just a second. That one's trying to bleed too. All right, let's let them take a look at that. Okay, and I'm going to come back one more time here and see if we can do just a little bit more in the corner of your mouth. Just one little wrinkle here. Okay. All right. Any questions?
Can I smile?
Yeah. Yeah. All right.
Very nice.
Well, thank you very much. We appreciate you volunteering for us and appreciate all you coming out.
So would you want to do this again before 2 years?
Yeah, so, well, the Voluma, the product that I put on her cheeks, it lasts 2 years. But again, you know, it's here tonight, and in 2 years it's gone. Most patients, 6 months, 9 months, they're going to have us touch that up when they're here getting their Botox or here getting their Juvederm. We would not use as much because at that point we're just kind of trying to fill the tank back up to kind of maintain that correction.